Hello. So, what you're about to see is a surgery. It's a spaying of a cat. There is nothing gross about it. There's no blood squirting. There's no gore. However, if you're squeamish, do yourself a favor and don't watch it. This video is intended mostly for young professional veterinarian surgeons who want to see a surgery on a live patient or for curious pet owners. So with that out of the way, you can continue watching. Okay, so now we're gonna do surgery, spaying on this little cat. It's anesthetized IV. This is my preferred method of anesthesia for this particular cat. It's IV, and yeah, as I go, I will walk you through the process. So now, this is disinfection for the area that I'm gonna be doing the incisions on. Okay, that seems fine. And now we move on. I need this for my tools. It's a sterile. And then we need this. This cover for the cat. Okay, looks fine. Moving on, we need obviously some instruments. I don't know if they'll be in the field of vision, but it doesn't matter much. I got my blade, and then I need a couple of clips. I need pincers. I need some thread. I'm gonna need sewing material. I'm gonna need gloves and one piece of swab. Now I'm gonna attach those clips so that it doesn't get too much in my way. And then we put the gloves on and we can go. Okay, so now we take my blade and we do an incision. So we're looking for this thing called white line, and I'm in luck because I cut just above it. Sometimes you gotta look for it, but not this time. And we have opened the abdominal cavity, and now we're gonna make a nice hole where I can put 2 of my fingers in. Okay, I think this should be enough. And now we're looking for the uterus. This is a baby cat. It's like 5 or 6 months, so the uterus will be tiny. There it is. Now I gotta make a hole. I don't know if you see it or not, but I'm gonna take the ovary out. I'm gonna do another clip just under the ovary. Okay. Now we're gonna pull this one because I need a little bit more space. That should do it. And now I'm gonna move on and do this. Now we gotta make sure it's really tight, so I'm gonna stretch it. Okay, this is fine. I'm gonna make another one. I'm gonna make another one to be completely safe, that there will be no bleeding. Okay, this is fine. We're gonna do a couple of knots, like 1, 2 is enough. Okay. Now I'm gonna do this clip right above the knot. Not right above, maybe half a centimeter. But this is where I'm going to cut. I'm going to cut under the clip to release. I'm going to put this there, making sure there's no bleeding. There's no bleeding there. Nothing's bleeding, so it's fine. And now we gotta release the ovary. To do this, I have this device called Ligashore, and it's doing something like okay, this blood vessel is sealed, so now I can cut. I can safely cut, and this makes sure that there's no bleeding when I remove the clip. Let me just wipe my tools a little. Now what I like to do is I hold this when I release the clip just to make sure there's no bleeding, there's nothing's going on. So I let it go. And now I gotta pull out the other part of the uterus. How do we do this? We just go with the finger there, and there it is. It's very annoying, this particular one. And now it's basically the same procedure. You gotta take out the ovary and clip underneath or above it, depends where you look from. Yeah, this should be plenty. And we do the other clip right about there, and then we do the same. Now we gotta make sure it's tight. Okay, it's very tight. Do one knot and we turn it around. You gotta again make sure it's very tight. Okay, that should do it. We do a couple of knots. Okay, I hope I don't need this, but just in case I'm gonna keep it around. Okay. Let's see now. Nothing's bleeding, so this guy can go inside. And do I need to move this? Maybe not, but I'm going to move it. And now again with the ligature for the ovary. That's it. Let me just clean my tools. Okay, the final check. We clip this. Nothing's going on. We let it go. And now we gotta do stitches. We gotta do stitches. And we're good to go. See, different people do stitches differently. What I like to do is separate stitches. I forgot their name of the stitch I'm using. It doesn't matter much as long as the result is fine. Okay, I got it. Now we gotta make sure it's tight. And I don't see it. Oh, there it is. I can cut with this, but it will annoy me. I'm gonna do it quicker with this blade. Is this blade faulty? I think it might be faulty. It doesn't cut very well. So depending on who's doing the stitches, people can do 2 or 3 layers. I am actually combining the muscle layer and the subcutaneous layer so that I only do 2 layers, but some people do 3 layers. The thing is, I have never had complication with this approach, so I am sticking with it. My point is, I don't think there's a right or wrong approach. You can do whatever feels better for you. Okay, this should be the last one for the muscle and the subcutaneous. And then we're going to do the skin. And yeah, this will be all. Okay, this looks fine. Now we're gonna do the skin. What I like to do is a suture that is in the skin. This is my third knot, maybe one too many, but it's fine. I don't pull it yet. I don't want to close the wound yet. I want to do it right before the end. But I've seen people pull it as they go. It's fine. Again, this is just, I believe, a personal preference, not a hard rule. Now I'm gonna do the last, I don't know, it's not a roll, doesn't matter, the last holes. And then before I close the wound, I gotta prepare for my knot. And I do it like this. And we hope for the best meaning we hope the knot remains inside when we close it. See, now we're gonna close this wound. Okay, closed very nicely, didn't it? It's like not even 2 fingers wide. Pretty good. And now we're gonna do the knot. Okay, this is fine. Let's cut this. Now we're gonna do the last motion. We do this so that it will pull the knot and hide it in the skin. This is all absorbable stitches, so in a couple of weeks there will be no trace of them. And yeah, we're pretty much done. I'm gonna put my tools away, and what I'm gonna do is clean the wound, and then I'm gonna put it in the box so we can wake up safely. So for the cleaning of the wound, what I use is hydrogen peroxide, but it's not the regular one, 3%. This is maybe like 15% concentration. It's very aggressive for my fingers, so I gotta always use gloves. But see, very pretty wound, like there's no wound at all. Now I'm going to apply this thing called silver spray. I don't know why they call it silver. They're not using silver, but it makes like a coating on the wound, prevents infection and stuff like this. So yeah, this is pretty much how we do a spaying around here.